ECG, as you might have known, it has to do with electrical transmission. It has to do with electrical activities going on in the heart. Okay, so there are few physiologies that you need to know. I'm not going to start talking about the anatomy and physiology of the heart now. However, there are some peculiar characteristics of cardiac muscle tissues. There are some attributes that are specific to cardiac muscles, and this influence the interpretation of ECG, the understanding of ECG. There are 4 of them. So we've got automaticity, excitability, contractility, and conductivity. Okay, so automaticity means ability of the cells to spontaneously initiate an impulse without any external stimulation. What this means is every component of the cardiac muscle tissues, they are capable of generating impulses independently. Okay, so whatever the situation is, every part of the muscle tissues have the ability to intrinsically generate impulse on their own, and that is automaticity. So they are not just reliant on a particular section of the muscle tissue, if that makes sense. But you understand that when we talk about the activation of the cardiac cells. Okay, but that is what automaticity means. It means they can spontaneously initiate impulse on their own. Excitability, all the cardiac muscle tissues, they have the ability to respond to impulses, to stimuluses. Okay. They can respond to electrical stimulus, they can respond to chemical stimulus. They are excitable. Okay, they are excitable. So when you stimulate them, they respond, if that makes sense. Okay, conductivity, that's the ability of the cells to transmit electrical impulse to another cardiac cell or from the point of stimulation throughout the entire muscle. So if the stimulation occurs in a particular part of the, just in a particular spot on the muscle, they have the ability to transmit that impulse throughout the entire muscle. That's conductivity. They can transfer that impulse from one part of the cell to the other as well. So they've got that intrinsic ability as well. And the last peculiar characteristics of this group of tissues is contractility. So as the name implies, they can contract following stimulation. So they have the ability to contract after receiving stimulus. Automaticity, excitability, conductivity, and contractility. I hope that is simple enough. You're going to be understanding the implications of all these characteristics as we move on in the training. So it's just providing a background understanding for you.